All right, we are live in Kigali for the Summit on Malaria and Neglected Tropical Diseases, which is taking place live. Let's take a listen.
Your Royal Highness, the Prince Charles, Your Excellency President Paul Kagame, Your Excellencies, Head of State and Government, Excellencies, Honorable Ministers, dear partners, esteemed delegates, all protocol observed. It is my pleasure to welcome you to this high-level session of the Kigali Summit on Malaria and Ntds. It is with great pleasure that I recount some of the outcomes and commitments from this morning session. First, incredible commitments were made by malaria endemic countries on co-financing towards the fight against malaria. Over $2.1 billion of funding commitments were spotlighted through today's announcement by the Global Fund as domestic commitments made between 2021 and 2023. It is clear that as we head toward the 7th replenishment of the Global Fund this autumn, endemic countries have done more than ever before to show their commitment to fighting malaria. Second, the launch of the Ntds Kigali Declaration today is a major milestone in the road towards ending neglected tropical diseases. Your Excellencies, the declaration has already galvanized unprecedented political and financial commitments from countries and partners to deliver the WHO 2030 roadmap targets on Ntds. As of today, $1.9 billion has been committed by partners, 18 billion treatments donated by pharmaceutical companies to treat a range of neglected tropical diseases, and you'll hear more about this commitment from companies' CEOs. We thank all partners who have endorsed the Kigali Declaration. Third, we have seen a range of additional commitments from the private, philanthropic, civil society, and other sectors exceeding over $1.2 billion for research and development. Being joined today by so many leaders is a strong endorsement that malaria and Ntds remain a priority for our leaders. I know that several speakers will bring forward new commitments to our fight, which I thank them for in advance. Finally, I wish to acknowledge and thank all stakeholders, including academia, civil society, private sector, and others who demonstrated their engagement to end malaria and Ntds. I thank you.
Thank you very much, Honourable Minister. As you have heard, this summit has provided a historic moment for our leaders to renew commitments to endorse the Kigali Declaration and to mobilize a fully resourced global fund replenishment later this year. And so we are gathered here in beautiful Rwanda at a tremendous moment to push forward together as a global community and indeed as the Commonwealth family. We are deeply indebted to our next speaker. Where do I begin? Is it his tireless efforts in bringing us all here? Or is it for the incredible display of hospitality, true friendship, and distinct leadership? It is my singular pleasure to introduce our host and the chair of the 26th Commonwealth Heads of Government meeting. Please give a very hearty welcome to His Excellency, the President of Rwanda, Paul Kagame.
Royal Highness, Excellencies, WHO Director General, Mrs. Melinda Gates, co-chair of the Bill and Melinda Gates Foundation, BioNTech CEO, Professor Ugur Shahin, senior government officials, global health advocates, business leaders, distinguished ladies and gentlemen. First of all, a good afternoon to you and welcome to Kigali. Thank you for the comprehensive report we have just had. Clearly, a lot has been accomplished during this summit. I want us to take a moment to appreciate the extraordinary coalition that has come together in this room. His Royal Highness, the Prince of Wales, who is also the patron of Malaria No More. Melinda Gates, whose foundation, in many ways, is the engine of global health progress. Mr. Tedros, whose extraordinary leadership of the World Health Organization is known to us all. Minister Shakbut of the United Arab Emirates and Minister Assata Tarsar of Senegal, who represent the commitment of governments to tackle these diseases together. Professor Ugur Shahin, CEO of BioNTech, with a major commitment to developing and manufacturing mRNA vaccines in Africa. And of course, all of you in the activist and scientific community who have ensured that malaria and neglected tropical diseases get the attention they deserve. I therefore congratulate the organizers, uniting to combat neglected tropical diseases, Malaria No More, and the RBM partnership to end malaria. This week, the Commonwealth will commit to working towards ending the malaria pandemic by 2030. We will need your support to make this happen. One key action item is to support the Global Fund's 7th replenishment. Today, we are also endorsing the Kigali Declaration on Neglected Tropical Diseases. Alongside the WHO's Neglected Tropical Diseases Roadmap to 2030, we have a clear action plan. I am pleased that the WHO has recently confirmed that sleeping sickness has been eradicated in Rwanda. But we still have much more to do. Ensuring that all African countries mobilize the domestic financial resources required for quality health care is a priority for the African Union and our partners. If there is one thing the pandemic has taught us, it is that together, through coordinated and collaborative action, we can achieve much more. Thank you for your kind attention, and once again, most welcome to our country, to our capital, Kigali.
Please rise. Thank you very much, Your Excellency, sir. Thank you. Thank you. This summit is a summit of firsts, and here's a first for you. It is the first royal visit to Rwanda. Yes, and we are delighted that on this inaugural trip, our next speaker would join us for this very event. His presence here is proof that the millions in our Commonwealth who are struggling with malaria and Ntds are seen and they are heard, and that we are determined to beat this together. Would you please help me welcome to Rwanda and onto this stage, His Royal Highness, the Prince of Wales.
President, Your Excellencies, distinguished guests, ladies and gentlemen, I am most touched to have been asked to join you here today at such a pivotal time in our history. And if I may, I would like to express my deep gratitude to President Kagame and all those who have contributed to making this summit happen so that we can drive our collective energy even further forward. Human health, planetary health, and economic health are fundamentally interconnected. And the past 2.5 years have seen the world battle an unprecedented global pandemic that has, and in many ways continues, to impact the lives, livelihoods, and economies of communities right around the world. At the same time, climate change is causing the length of the malaria transmission season to increase in many parts of the globe. A recent study from the London School of Health and Tropical Medicine showed that if global mean temperatures continue to rise to 3.7 degrees Celsius by the end of the century, an additional 4.7 billion people could be living in areas at risk of malaria and dengue transmission. So here, the Commonwealth has a vital role to play. As President of Malaria No More UK, and building on this and last CHOGM summit, I continue to support our collective ambition to halve malaria by 2023. We must also acknowledge that the burden of neglected tropical diseases is also a hugely important issue. Such diseases are endemic in 46 of the Commonwealth's 54 countries, thereby representing 2/3 of the world's burden. So I very much welcome, ladies and gentlemen, the declaration that has been launched today. While we have achieved so much in the malaria campaign since 2000, I'm afraid that largely due to the COVID-19 pandemic, there remains a great amount to do if our ambitions are to be met. I can only hope, therefore, that today's meeting signals the necessary focus and prioritization of funding for novel therapeutic, prophylactic, and vaccine strategies against malaria. For example, I understand that the Global Fund to Fight AIDS, Tuberculosis, and Malaria reported that 188 million mosquito nets were distributed in 2020, a 17% increase compared to 2019, despite COVID-19. And there is a wider hope. We now have more valuable assets at our disposal than ever before. For example, the first WHO-approved vaccine, new nets, and modern communications tools to monitor our progress and fight against complacency. Your Excellencies, ladies and gentlemen, these efforts take bold ambition, concerted action on the ground with communities and partnerships across borders. And here, if I may say so, it is really inspiring to see so many Commonwealth leaders talking to one another to ensure that life-saving medical, material and preventative supply chains can keep flowing across our borders. Similarly, we know that this is a battle that is fought on the ground in local communities and by citizens themselves. In this regard, we acknowledge and give particular thanks for the tireless efforts of community health and prevention workers who each make such an important difference. And I thought there'd be quite a lot of you in the audience today, because you really are absolutely crucial and critical to this battle. So I hope this summit will give you some encouragement. So as we emerge from the pandemic, 2022 must be a turning point. Post-COVID-19, the world is paying greater attention to infectious diseases, and we must capitalize on this to provide proper support to prepare for and respond to infectious disease outbreaks. It is most encouraging to see that leaders of the Commonwealth will discuss and pledge their support for this campaign and are committed to work towards ending the epidemic of malaria by 2030. I very, very much welcome this determination and that we are not turning our back on a job unfinished. After all, ladies and gentlemen, the Commonwealth is uniquely placed to help the world in this effort. We need only recall the Commonwealth's commitment in 1987 to end polio and how close we are now to reaching that goal, even if we have faced setbacks over the years. We can achieve the same with malaria. Your Excellencies, ladies and gentlemen, these are challenges that affect us all as one people living on one planet. Therefore, to solve them for present and future generations, we all have a responsibility to come together to accelerate action and the scaling of solutions. Thank you, ladies and gentlemen.
Thank you very much, Your Royal Highness. His Royal Highness will be leaving us, but allow us to express our gratitude for joining us for this summit. Thank you very much. Thank you. Please do have your seats. Well, we were graced by her presence this morning, and how blessed we really are to have her join us again. Would you help me welcome onto the stage award-winning author Chimamanda Ngozi Adichie.
Distinguished ladies and gentlemen, good afternoon. When my daughter was born, I told myself that I will try very hard to make sure she did not get malaria before she turned 6. I had read somewhere that children are a little bit more resilient to illness after the age of 6. Because I knew how terrible malaria had been in my own childhood, I didn't want her to suffer as I had. So every day I would very meticulously spray her skin with insect repellent, her ears, her toes, her neck. And so instead of those deliciously innocent scent of babies, like fresh talcum and lavender, my daughter smelled of insect repellent. I often examined the mosquito window netting, checking for holes. A frequent refrain that friends and family heard from me when they visited our Lagos home was, "Mechu's also maka mosquito." Shut the door quickly because of mosquitoes. My daughter will turn 7 this October, and she has never had malaria. This, for me, is a very tiny example of what can be achieved when we put our minds to it. I remember a cousin telling me it didn't matter what I did, that my daughter would get malaria because, well, everyone gets malaria. Malaria is so common that we think we have to have it. But we don't have to. Malaria can disappear from our lives forever. Malaria has been eliminated in 40 countries so far, with China being the 40th this year. But for us in many parts of Africa, it has not. And malaria is not the only disease which needlessly plagues millions of lives. Many gains have been made in the fight against malaria, but we must keep pushing to the final finish because this parasite is very clever, which is why malaria has existed on Earth as long as we humans have. Now is the time for the final push. Now is the time for faith and for hope. Because to believe that we can end malaria and neglected tropical diseases is an act of hope. There is nothing more important to the human spirit than hope. To have hope is to know that a future will be better than the present. It is to actively believe in a future. We have the knowledge. What we need now is leadership. Leaders who believe, leaders who have hope. It is easy to ask, if we can eradicate this, and if all we need is leadership, then why haven't we? It is not because leaders are bad people who want malaria and diseases to continue to ravage this continent. It is because leadership is difficult. It is about making choices, about challenges to budgets, about deciding what to make a priority. We must make ending malaria and other tropical diseases a priority because we know it can be done. We know malaria kills. It is catastrophic when a person dies of an illness, but there is an added pain and poignancy when that person dies of a disease that is completely curable. Across this beautiful continent of ours, so many children have died of malaria. Those children did not have to die. Imagine what we have lost as a community, as a continent, as a people. So many voices forever silenced, so much talent forever unused, so many ideas unformed, so much progress unmade. Still, a disease does not have to kill to have a profoundly debilitating effect on individual lives and on economies. The labor lost to the lethargy of malaria, the lack of faith and hope, the resignation that so many people like my cousin have who believe that malaria is inevitable. We cannot create a perfect world, but we can create one that is much better than what we have now. Malaria and other neglected diseases have blighted our past and continue to diminish our present. We've had enough. We must refuse to let these diseases steal our future. And thinking of this makes me remember my beloved father's words. My father was a professor of statistics. I have never liked mathematics. And once I took practice exam papers to my father, and I complained about all of the problems that I could not solve. And he said to me, "Show me the problems that you can solve." And I did. And then he said, "When you get into the exam, first go through and solve what you are sure that you can solve. And then afterwards, go back to the others and try solving them before your time is up." Our world today is bruised and battered by COVID. We are still learning about COVID. And it is, of course, imperative that we understand COVID. But we already understand malaria and other neglected tropical diseases. We can solve them. Sometimes it is an act of courage to believe that something that can be solved can, in fact, be solved. We need courage. If we eradicate malaria and other tropical diseases, our health clinics would be strengthened and would be able to focus on the things we do not fully know, on other diseases we do not yet fully understand. Because sadly, other pandemics will come in the future. It feels wrong, morally wrong, to know that we live in a modern world of self-driving cars and drones and visits to space. And yet, these ancient diseases, these diseases that we know can be conquered because they have been conquered in different parts of the world, are still killing so many people in the Commonwealth. This is the time to show what can happen with a collective will. And it has to be collective because mosquitoes and those diseases do not recognize borders. We can, indeed, in the most literal sense, not only change the world, but change the world on a truly magnificent scale. Imagine what we would unleash across the Commonwealth, across this beautiful continent, if we eradicated malaria and other tropical diseases. We can craft a new future for our people. It can be done in our lifetime. We can make history as the generation that finally rid the world of these terrible diseases. And now is the time. Thank you.
Thank you, Chimamanda, for that reminder. It takes courage to save lives. Somebody who knows a great deal about changing lives is our next speaker. As the co-chair of the world's largest private foundation and also as an advocate for women's equality, Melinda French Gates has been consistently ranked as one of the world's most powerful women by Forbes. And she is using that power to do a whole lot of good, and we are delighted to have her. Would you please help me welcome onto the stage the co-chair of the Bill and Melinda Gates Foundation, Melinda French Gates.
Well, thank you, President Kagame, for hosting all of us here, welcoming us to the summit, but really for your leadership and your foresight, not just for Rwanda, but for the rest of the continent as well. We're so pleased to be here at CHOGM and to have this summit run alongside it because of its importance. So I also want to say warm greetings to all of the dignitaries and partners who are here in this room today. I am so happy to be back on the continent of Africa again, and it feels like an absolute honor to be here with all of you. Now, as I look out at this distinguished crowd, I'm reminded that there's one really important face that's missing. Dr. Mele Chela. She was at the World Health Organization as the director for many years of neglected tropical diseases, and she passed away earlier this year. And what I want you to know about Dr. Mele Chela was she wasn't just committing to ending diseases that are neglected. She worked tirelessly to make sure she was reaching the people who were most often affected by these diseases, and the people who are most overlooked. And I know that in this same spirit, it's what guides so many of us here in this room today. Now, over the past few decades, it's been really inspiring to see the way that leaders have come together to combat both malaria and neglected tropical diseases. Multilateral organizations, donor nations, pharmaceutical companies, and most of all, leaders across Africa and around the world, from government officials and health workers to advocates and amazing scientists. Thanks to these efforts, malaria deaths have been cut in half. Also, the number of people requiring treatment for NTDs has fallen by 300 million. That's staggering. Guinea worm has gone from infecting more than 3 million people a year to only 15. And no, I didn't make a mistake. Not 15,000, not 1,500, just 15 people in the last year were affected by guinea worm. And as you heard earlier, here in Rwanda, sleeping sickness has been completely eliminated. So this progress that we're talking about, it's remarkable. It's possible. It gives us reason, as Chimamanda says, for hope. It reminds us that when we come together, we can do something great. But we also have to be realistic that progress has stalled because of the last 2 years of COVID-19. So funding for malaria and NTDs has plateaued. Unfortunately, malaria deaths are rising. And while we have these amazing new tools and treatments which are emerging literally in the months ahead, they may not reach those who need them the most. So it means we all have to do more. And when I say we, I mean all of us in this room. There is absolutely no nation and no organization that can do this work alone. So for our part at the Gates Foundation, we're stepping up our commitment and we're pledging $140 million over the next 4 years to support African institutions in fighting malaria. Despite how devastating COVID-19 has been, I think one of the things we all came to realize as a community is that we have got to put Africans first, and that scientists as partners and leaders. So we will also be announcing that with our African partners and the institutions that are fighting malaria, we're going to launch a new philanthropic fund with 2 other partners in collaboration against neglected tropical diseases. That is the Children's Investment Fund Foundation and the Elma Philanthropies. They're both going to come into that fund. So in memory of Dr. Mele Chela, who understood what's possible when women and girls lead, she understood the resilience of women. She understood the women female scientists. She understood the women on the front line and how ingenious they were about giving messages and solutions to communities. So we're going to partner with the WHO to support a program to develop women leaders to combat NTDs. We're calling on world leaders to take 2 important actions. One, we're asking everyone here in this room to endorse the Kigali Declaration on NTDs. By 2030, we can eliminate NTDs in 100 countries. And second, we're asking everyone to increase their commitment to the Global Fund. If the Global Fund hits its $18 billion target, if the Global Fund hits its $18 billion replenishment target, malaria cases will fall by 2/3 by 2026. With this support, Africans and their partners can accelerate health R&D. They can use the smart tools and systems they have to track diseases and deliver treatments tailored to each community. They can strengthen the primary healthcare systems that save lives. And through it all, in the spirit of Dr. Mele Chela, we can make sure that the focus stays on those who are too often left behind. Thank you.
Thank you very much indeed. Very shortly, we'll be hearing from various heads of state and government who have so graciously joined us. But first, we are very grateful to have the scientific community with us today. We rely on their expertise to make millions safer, healthier, and in some cases, to give them a brand new lease on life. Founded by scientists and physicians, BioNTech believes in scientific rigor and passion, and so do we. So please help me welcome to the stage its CEO, Professor Ugur Sahin.
Excellencies, Head of States and Governments, distinguished guests, dear colleagues. About a year ago, we started our mRNA-based Eradicate Malaria project. It has 2 simple goals. The first goal is to develop a well-tolerated and highly effective mRNA-based malaria vaccine with a durable protective immunity. The second goal of this project is, once approved, ensure a sustainable manufacturing and supply of mRNA vaccines from the African continent. Allow me to shortly explain the project. Why now? Now, because of the slowing of the progress in malaria eradication. Despite the success of the last decades in the eradication of malaria in many regions of the world, we are seeing that we are reaching limits what can be achieved with imperfect prevention tools. The second is a positive reason. It's the emerging understanding of malaria biology and immunology, and it's also the reason why we are engaged in this project. We can build on decades of malaria research funded by international organizations like Bill and Melinda Gates Foundation, and we can rely on the first understanding that immunological mechanisms could be useful to prevent malaria with the first approved vaccine and with antibodies showing preventive activity. So the question is, why us? As a company founded by medical doctors, the health of an individual one is what drives us. We are committed to bringing our innovations to those who need them. Thus, malaria is an obvious mission to us. Our mRNA technology has allowed development of an effective vaccine against a pandemic disease. Its flexibility, speed, production scales, and ease of supply has a great impact, may have a great impact on global health.
All right, we are, of course, giving you live coverage at the... Okay, we're going right back to live coverage in Kigali. Let's continue.
Our vision aligns with the WHO's strategic view and aims to develop a highly effective Plasmodium falciparum blood stage infection prevention vaccine that at an individual level prevents disease and death and onwards transmission. We are immunologists. We believe that there is plenty room to develop an improved vaccine. We will not only test the vaccines and antigens which have been used previously, but also use new antigens. We aim to discover new antigens that can help us to attack the virus not only before entering the liver stage, but also in the liver stage. We want to start clinical trials by the end of this year. We had in the meantime tested more than 80 candidates and identified the first candidate for clinical testing. We have a date for starting our clinical trial, but we do not define a date for the vaccine to be ready. We want to develop a truly effective vaccine. If necessary, we shall iterate, and if required, we will identify new antigens. Rest assured that the power of the scientific excellence and the will of our teams at BioNTech made a difference, and I believe that this success can be repeated for malaria. And we will be prepared for success. It is clear to us that a potential future malaria vaccine must be produced in Africa for Africa. Here, by the end of this year, we plan to have a setup of our first state-of-the-art mRNA vaccine factory. Our BioNTainers are high-end, fully digitalized, modular mRNA manufacturing facilities, allowing to produce up to 100 million vaccine doses per year. We anticipate that we can start manufacturing of first mRNA vaccines here in Rwanda end of 2023. Similar modular vaccine factories are planned to be established in Senegal and South Africa. We believe that these are ambitious goals. But I personally believe that goals must be ambitious to be attractive. Sometimes an ambitious goal is easier to achieve than a non-ambitious one. We will do our work in a collaborative manner. We are currently supported by world-class experts in malaria, by the Bill and Melinda Gates Foundation, by the Kenneth Foundation, by the European Union, by the African Union, by national regulatory authorities, by the WHO, and many others. I would like to thank our team and these partners for their continued support.
Your Excellencies, distinguished members of the Commonwealth, our unity, our shared values and aspirations couldn't be more critical. At this unprecedented moment in human history, it is only the continued steadfastness in our convictions that can safeguard our future. And that commitment couldn't be clearer than what you're about to hear. Let me now introduce to the stage our leaders who will articulate this for all of us. Please help me welcome first on stage His Excellency the President of Botswana, President Mokgweetsi Masisi.
All right, that is, of course, ongoing live coverage of the Malaria Summit in Kigali. We've heard from a host of individuals, the Minister of Health, Daniel Namije, the President of Rwanda, Paul Kagame, Prince Charles, Chimamanda Ngozi Adichie has spoken, Melinda French Gates, and we have, of course, the President of Botswana. I think we're going to go back live now to pick that up.
WHO, it gives me enormous pleasure to be here to share with you and confirm to you Botswana's commitment to ending malaria and to addressing comprehensively neglected tropical diseases. The reasoning for it and the rationale for so doing has been amplified by previous speakers, but I'd like to re-emphasize it from the perspective of Botswana. We have spent consistently for most of the years of our independence, which are just over 50, in excess of 20% of our budget on health. In spending on health, we have built what we believe are resilient health systems, and we continue to improve the efficiencies of such with support of partners such as WHO, so that we are in a better position to respond to pandemics, including to fight against malaria and Ntds, to yield healthier populations. We know that in 2018, the Commonwealth committed to halve malaria across the Commonwealth by the year 2023 and eliminating blinding trachoma by 2020. Botswana, for your information, has been put on the WHO category of countries for malaria elimination by the year 2025. Over the years, we have reduced the burden of malaria incidence from 10.07% per 1,000 people in year 2008 to now 0.3 per 1,000 in 2021. Parallel to that has been the significant reduction in case fatality rate from 9.99 to 6.72. The key interventions put in place include surveillance, enhancing and optimizing case detection and case management, optimizing vector control, as well as strengthened public health education. And yes, I'd have to agree with Melinda Gates, the women were right in the forefront of this. And working in partnership and collaboratively through cross-border initiatives. These key interventions aim at attaining the following key strategic objectives, which are achievement of universal coverage of appropriate preventive and treatment interventions for all populations at risk of malaria in all transmission areas, strengthen social behavior communication and community engagement, and strengthen capacity of the National Malaria Program for effective leadership and coordination of malaria elimination. With regards to neglected tropical diseases, Botswana recognizes the critical importance of investing in the fight against these diseases, restoring dignity and health to communities and individuals particularly affected by Ntds. Neglected tropical diseases continue to disproportionately affect impoverished communities, pushing them into deeper poverty and disability, a situation we can no longer ignore. As a country, we acknowledge that though there has been significant reduction in the number of cases registered over the years, to remain on track, the country conducted a rapid assessment of trachoma in 2019 in one district with a view of expanding such survey to fully quantify the extent of the problem through the support of site savers. We do acknowledge that the consequence of Ntds stretch beyond the health sector, greatly denting our economies, particularly of African countries, and that the suffering of our people is unnecessary. However, one notes with concern that over the years, neglected tropical diseases have seen a gradual reduction in funding. But refreshing it is this afternoon to hear the announcement of this new funding. To conclude, one must note that the COVID-19 pandemic resulted in a disruption of primary care services, which included advancing preventive interventions for both malaria and Ntds. We call on and ask for support for building resilient healthcare systems through the revitalization of primary health care, which is appropriate. And I urge leaders of the Commonwealth to avail more resources to be committed to this agenda as we build back better. And it's always best to begin with your own domestic resources. We say this with the conviction of the experience we have in Botswana, where we did it and we will continue to do it. Thank you.
Thank you very much, Mr. President. Ladies and gentlemen, distinguished guests, please help me welcome on the stage now His Excellency Dr. Philip Mpango, Vice President of the United Republic of Tanzania.
Excellencies, distinguished delegates, first I wish to convey fraternal greetings from Her Excellency Samia Suluhu Hassan, the President of the United Republic of Tanzania. Her Excellency wishes this summit great success. Allow me also to thank the government of Rwanda for convening this summit to review the progress made since our 2018 commitment to halve malaria across the Commonwealth by 2023, eliminate blinding trachoma by 2020, and to combat other mosquito-borne diseases. Excellencies, efforts to achieve our commitment have been challenged by the onset of the COVID-19. The pandemic placed an extra burden on health systems, and in particular in countries with fragile health systems like Tanzania, on top of the existing threats to public health especially malaria and other Ntds. However, Tanzania was encouraged in 2021 when the World Health Organization endorsed a malaria vaccine that has proved to significantly reduce malaria in young children. Excellencies, distinguished delegates, it is very important that our recovery plans to strengthen public health systems include robust action to end malaria and neglected tropical diseases. In Tanzania, we have, in cooperation with our partners, been able to scale up coverage of malaria vector control and case management interventions. As a result, Tanzania has experienced a marked reduction in malaria prevalence to hypoendemicity level. In recent years, Zanzibar and 5 regions of mainland Tanzania, which account for about 16% of Tanzania's population, have been able to reduce malaria prevalence to less than 1% and target to reach zero malaria by 2025. Among the major interventions that were implemented include indoor residual spraying by using blanket spraying, real-time monitoring by using smartphones, and strengthening malaria diagnostics. Tanzania is also currently implementing a 5-year national malaria strategic plan, 2021 to 2025, aiming at reducing average malaria prevalence to less than 3.5% in 2025 from 7.5% in 2017, and eventually eliminate malaria by 2030. Excellencies, distinguished delegates, besides malaria, neglected tropical diseases constitute a significant public health challenge in Tanzania, with over 29 million people requiring treatment of at least one NTD. To address this challenge, Tanzania integrated the coordination and implementation of 5 preventive chemotherapy Ntds control and elimination activities, including mass drug administration, health education, and morbidity management. In addition, Tanzania is currently implementing a 5-year strategic master plan to the Neglected Tropical Diseases Control Program 2021 to 2026, which aim at sustaining the gains made to control and eliminate Ntds and scale up disease monitoring and surveillance. As a result of these interventions, we have, in collaboration with our partners, been able to attain full geographical coverage for mass drug administration in all of our districts. Transmission assessment and surveys indicate significant decline in prevalence of all the 5 Ntds. The number of districts requiring mass treatment against trachoma has declined from 71 in 2012 to only 9 by February 2022. And the number of people requiring surgical interventions for trachoma has declined from 167,000 in 2012 to 13,401 by February 2022. Excellencies, distinguished delegates, in conclusion, the United Republic of Tanzania reiterates its commitment to scale up malaria and Ntds responses. We call for partnership and heightened stakeholder collaboration to increase investment in preventive measures, diagnostic testing, treatment and disease surveillance, as well as harnessing innovation and expanding research in order to accelerate our pace to meet the 2018 commitment. I thank you.
Thank you, Mr. Vice President, sir. And now, His Excellency Sheikh Shakbut bin Nahyan Al Nahyan, Minister of State.
All right, we've just heard from the Vice President of the United Republic of Tanzania, Dr. Philip Mpango, who has just spoken about his country's commitment to the fight against malaria, as we also heard from the President of Botswana, Mokgweetsi Masisi, and all the other high-level speakers, including Melinda French Gates, Chimamanda Ngozi Adichie, and the President of Rwanda himself, Paul Kagame, and Prince Charles in his first visits to the nation. So very high level, lots of commitments made. And I believe we're about to bring in our very own Leila Johnson Salami, who is live in Kigali to give us a roundup of what we've heard. Leila, good afternoon. Great to have you still there. What do you make of what we've heard today? A lot of big speakers. A lot's been said.
Absolutely, Rotas. Good afternoon to you as well. You know, it's interesting because in 2018, Commonwealth leaders committed to halving malaria across the Commonwealth by 2023. Today, we're hearing about commitments to end malaria and neglected tropical diseases by the year 2030. Now, that may sound ambitious, but just as Chimamanda Ngozi Adichie pointed out as she spoke, this is all about political will and leadership. This is all about Commonwealth leaders deciding that we want to put these issues at the forefront. We want to take these issues seriously because we've seen that it can be done. Malaria has been eradicated in 40 countries, and China, I believe, is the last country to have just eradicated malaria. So yes, malaria can end, and yes, neglected tropical diseases can end if we give it that extra bit of thought and that extra bit of care. So we've heard a lot today. Like you just said, loads of high-level speakers at this high-level summit. We heard from Prince Charles. We heard from Chimamanda, as I mentioned. We also heard from President Paul Kagame. We heard as well from Rwanda's health minister. Sorry, I'm just going through the list. And we also heard from Melinda French Gates, and also we heard from the CEO of BioNTech. Now, I must note, we were all looking forward to hearing President Muhammadu Buhari speak. He was supposed to speak before the president of Botswana, but it turns out that he didn't speak in the end. It's unclear as to why, as for now, but I do also know that he didn't speak at the summit earlier on, the business conference summit earlier on this morning that he was supposed to speak at, which was on sustainable urbanization in sustainable cities. So I'm not sure what's going on, but the president wasn't speaking at this high level, or rather isn't speaking at this high level summit on malaria and neglected tropical diseases.
All right, and so Leila, thanks for the roundup. So basically, I mean, with everything that we've heard, it seems like there is positive anticipation for a multilateral approach to eradicating malaria. That seems to be the takeaway from all of this.
Absolutely, Rotas. One line that's not left me since this morning is that we need to break the bank if we want malaria to end. It's going to take financial commitments, and we've seen some of that today. I believe that President Paul Kagame came out to speak about that's wrong. The health minister of Rwanda came out to speak about a $1.9 billion investment into ending malaria and ending NDTs. We also heard from Melinda French Gates, who has said that the Gates Foundation is now committing another $140 million to the cause as well. So we've had a lot of monetary commitments coming out today, which does give hope. But does that mean that malaria is going to end by 2030? Well, it's going to be hard, but it can be done if the right care, like I said earlier, and the right political will is in place. But we have to wait and see. These are all commitments, and these are all words that we want to see translated into action. And yes, we're seeing financial actions and commitments, but we have to see what happens. And honestly as well, Rotas, I must say, it takes every single individual working together to ensure that we do end malaria. I mean, these are diseases that we grew up with as children. These are diseases that people are still living with now. Just 2 days ago, I spoke to a lady in Lagos who lost her 22-year-old son to malaria. And you think about it and you're like, should people still be dying of malaria in this day and age? Unfortunately, it's the reality. So the political will to end it is necessary at this point in time.
Indeed it is. That is a very tragic the note there with that 22-year-old adult, basically. Anything else to look forward to at this point after this gathering or tomorrow?
Well, I know that a lot of delegates who are attending CHOGM 2022 are going to be out in Kigali tonight. There's the Commonwealth Fashion Week, so people are going to be letting their hair down and, you know, trying to have some fun. Tomorrow, the official opening ceremony kicks off for CHOGM 2022, and all throughout the day tomorrow and on Saturday as well, we can expect high-level meetings with global leaders on causes that have been discussed this week, right from the Youth Forum to the People's Forum to the Business Forum. All of these discussions are then going to be put at the forefront with Commonwealth leaders, and then on Saturday they will hold a press briefing at some point to give us an insight into the new commitments that the Commonwealth is sharing with us, and we have to wait and see. But high-level meetings all through tomorrow and Saturday as well, so it's going to be 2 very busy days. Not as much activity, I must say, as the past few days with the forums going on, as it's going to be more closed-door meetings, so on and so forth. But come Saturday evening, we will have more updates with regards to what Commonwealth leaders have decided to come out of CHOGM 2022 with. We will have an idea of the commitments that are set in stone. Now, does this mean that those commitments are going to translate into change in different sectors and different spheres? Well, it's all about the political will behind it. I've mentioned this a couple times. The Commonwealth is not treaty-based, so in order for these commitments to translate into action, it takes political will. But we'll wait to see what the overall roundup is on Saturday evening. But high-level meetings all day tomorrow and Saturday.
All right. Well, Layla, we're glad to have you boots on the ground following up on all these events. Layla Johnson-Salami, Arise correspondent in Kigali, taking everything in and giving us the roundup of what's been going on. Thank you so much for that, Layla.